Hello, everyone. My name is Abhinav Mishra. I'm a medical student at the Renaissance School of Medicine at Stony Brook University. And today I'll be presenting the prognostic value of lumbar facet joint effusions on MRI as a predictor for future back pain, a retrospective analysis. We worked this in conjunction with doctors from Columbia University along with Stony Brook University. And so, an introduction. Lower back pain affects millions worldwide and is a leading cause of substantial healthcare costs, decreased productivity, and a worse quality of life. In many cases, further down the line, it leads to degenerative disc diseases, disc herniations, as well as many more pathologies. And so the reason that we focus on facet joint effusions in particular is that these synovial joints present in your spinal cord, or in your spinal column rather, are affected in many pathologies. They're susceptible to effusion, and these effusions are visible on T2 weighted MRIs. And so whether or not these effusions were correlated with future problems down the line could be a way for us to predict these problems in advance and a way for us to treat them better as well. And so the purpose of our study was to evaluate the prognostic value of these effusions as on MRI as a future predictor of these spinal instability issues as well as back pain. The methods. We used a retrospective review. We looked at both EMRs and MRI scans from past patient records in order to see whether or not there were fascial joint effusions present, as well as to determine whether or not there was a future back pain or spinal problems. The patient population that we focused on was Stony Brook Hospital patients. There were about 7,300 patients that received MRIs for lower back-related concerns over a 5-year time span. This spanned over 2009 to 2014. And we focused in on the fact that the age of these patients needed to be less than 45 years of age because we didn't want age to be a confounding variable in the back pain that we found. And so the exclusion criteria, like I mentioned, age was a big thing. If they were over 45, they were excluded from the study. If any native spine abnormalities were found, we excluded them from the study. And if there was no follow-up imaging or EMR notes, then we excluded them from the study as well. In terms of our experimental control groups, they were divided as follows. Our experimental group was defined as having fluid in either one side or both sides of their spinal facet effusions, joint spaces. Along with that, they needed to have an absence of any other spinal abnormalities. And so if there was the presence of a spinal abnormality on top of fascial joint effusions, then we excluded them from the study. Additionally, for our control, there were no fascial joint effusions, but there were also no other spinal abnormalities to make sure that we were comparing them to perfectly healthy individuals. So these are just examples of MRI scans that we found. For example, the bilateral effusions that we saw and what we defined as a bilateral effusion, as well as the unilateral effusions, the right-sided and left-sided effusions that we saw when we were looking through these records. And so when all was said and done, we were left with 196 patients in our experimental group, of which 20 had left-sided effusions, 25 had right-sided effusions, and bilateral effusions were limited to 151. And our control group were 88 patients with no fascial joint effusions at all and no other spinal abnormalities. From there, we looked at whether or not these patients had future back pain or spinal abnormalities. And so when all was said and done in terms of our results, we found that in our left-sided group, out of the 21 people that we had put in that category, 14 developed future back problems. In our right-sided group, out of the 25, 12 had future back problems. In our bilateral group, out of the 151, 63 had back problems. In our control group, however, out of the 88, only 20 had back problems. And so even just optically, we noticed that the incidence and prevalence of future back problems was definitely higher in our facet joint effusion groups. And so from here, we wanted to conduct a statistical analysis, and we went to the chi-square test for independence. And we found that there was a very significant correlation between back problems and effusions. And so on our left-sided, we found that the incidence was 70% with a p-value less than 0.001. Right-sided 48% with a p-value equal to 0.012, and a bilateral percentage of 41.7% with a p-value less than 0.01. We also wanted to look at, and the secondary variable we wanted to look at, was the average number of years between initial MRI and future back problems. And we found that, overall, they were very similar, and there wasn't a very, even just optically speaking, a clear statistical significance between the control group and our experimental group. We used an ANOVA analysis to determine this, and it yielded a p-value of 0.615. So our discussion, in terms of what we could conclude from this study, was that there was a significant association between left, right, and bilateral fascial joint effusions and future back problems. It supported our hypothesis that fascial joint effusions as were good early indicators of spinal degeneration and instability. However, we found that it wasn't a clear correlation between the time and the number of years between the initial MRI and future back problems among groups. The limitations of the study include the fact that it's a retrospective study, and so it's hard to extrapolate, future points from it. Additionally, it's limited in its extension and extrapolation to people above the age of 45 because that was one of our exclusion criteria. Additionally, it doesn't evaluate the severity of back problems that one might, perceive with their fascial joint effusions. It's possible that some of the patients were not experiencing extremely significant back problems, and some were, and so we didn't really account for that in our study. In terms of what to do next, it's clear that a prospective study is what needs to be done next, which can better assess causality. We can expand our study to multi-center studies, and we can try and understand the underlying biomechanical or anatomical factors that could be contributing to the facet joint effusions, as well as how they lead to future back problems. Thank you so much for listening. I hope you have a great conference.